Welcome back. It's Monday morning, and that means it's time for Mental Health Monday. Joining us now is Holly Lockman and Janelle Rubelt, two nurse practitioners with West River Mental Health. So, kind of starting off, how are both of you doing this morning?
Doing good, thanks.
That's excellent to hear. And this morning we are talking about medication management for those people that are using medication for mental conditions, disorders, whatever they might use those medications for. So let's talk about that medication management. When we're saying that, what do we mean?
Sure. Yeah, so if you're struggling with mental health, whether it's anxiety, depression, something stressful going on in your life, you can reach out. Your primary care provider, if you have a mental health provider, start medications. They can be very, very helpful.
Yeah. And just because you start a medication does not mean you have to stay on long term. It's just kind of a stepping stone and helping block for getting through what you're going through at that time.
And so what's the best way for someone to kind of manage, their medications at home?
Be sure to take them daily, take them as prescribed by your provider.
And understand they take time.
Yeah.
A lot of, say, your antidepressants or anti-anxiety can take up to 4 to 6 weeks before you start feeling a real effect from it, so that can be kind of frustrating.
And, kind of going off of that, especially, understanding the medication, is that something that someone's provider, healthcare provider would kind of explain to the patient when they're first prescribing them this medication?
Yeah, it should be part of that conversation, that side effects, what to expect, how to titrate the doses, meaning if you need a little bit higher dose or if you're not doing well on it, how to come down off of doses.
Yeah, or change medications. And, sometimes taking one medication, it might not, don't be discouraged. If you take one medication and that one doesn't work, there's always an option to change or add something on.
Right, and what are some of the downsides if if someone happens to misuse their medication?
Unfortunately, that is a common thing. It can happen with certain meds. You just always increase your risk for side effects, and it's not going to work if you don't use it for what it's intended to be used for.
Yeah, absolutely.
And if someone is looking for those resources to kind of help them get back on track with their medication usage, who should they contact? Where should they go?
They can reach out to their primary care provider if they have one. They can reach out if they're in a mental health crisis at all, struggling with feelings of suicide, self-harm, depression. They can reach out to Pivot Point. That's 308 Quincy. Or West River Mental Health for outpatient services. Yeah.
And then kind of just wrapping up here, final question is, we hear about this, especially since you mentioned we hear about this a lot, unfortunately. What's a message you have for those that unfortunately are doing that?
It happens to a lot of people. You're not alone, and there are resources out there, so please reach out.
There's help, for sure.